Well, for more on this story, we've reached Dr. Samir Sinha. Now, he is a director of geriatrics at the Mount Sinai and University Health Network Hospital in Toronto. Thanks for joining us, Doctor. Let's talk about your reaction as you have heard about the situation in particular in Quebec, but in elder care facilities generally across this country.
When the story in Quebec hit, John, I just cried because these were things that we couldn't imagine ever happening in our own country. We heard about dispatches like this happening in Spain, where homes were being abandoned by staff, the military were finding people dead. But, you know, that's a different place, right? That's a country that has a good healthcare system as well. But that's Spain, that's not Canada. And what we've seen here has been repeatedly, unfortunately, playing out, where thousands of homes, over 1,000 homes now, across Canada are in outbreak. Hundreds of people have been dying. And then we've been hearing about what's happening in Quebec, and especially at this home. My heart goes out to every one of those families and every one of those residents, because no Canadian should ever have to think that that could ever happen in our country. And the sad shame of it is it did.
It did, and now the search for answers, as Laura was telling us, a police investigation very much underway. What do you hope that the police will look into?
You know, I think what people have been uncovering was why these homes are so vulnerable. You know, they contain some of the most frail individuals in our society. They need expert care. And unfortunately, we have a system that across the country has been grossly underfunded, and a system that doesn't even give its own workers, for example, full-time wages and benefits like sick days. Many workers were not getting the personal protective equipment they needed. The idea of just wearing a basic mask every day. And so when you're being paid minimum wage, when you don't have sick benefits, when you don't, you know, to a certain extent, you can appreciate why some workers didn't want to put themselves in the line of fire. But the challenge is that we're actually seeing here is that when we're not supporting a workforce and when people have to work through multiple homes, caring for some of the most vulnerable individuals, this is why COVID-19 can get in and it can spread quickly. And if we don't actually do the right things we need to do, such as infection control practices and other things, we then start seeing things that spark an incident that was totally out of hand and is just unspeakable.
We are very much still in the midst of the crisis, but if we could maybe jump off from what you were just saying in your last answer, looking forward, what sort of reforms, what sort of changes to the system do you think we should have and may have heading out of this?
Well, I think we've already seen what's happening in provinces like BC. In BC, they just indicated last week that not only are they requiring all staff to only work at one home, they're trying to end this practice of providing low wages, and which forces people to work in multiple homes by saying we're now going to support workers in these environments doing very challenging care to actually get full-time work with benefits. And they've said in BC that this is not just during the pandemic, you know, this will be forevermore. Alberta has come forward and said they're doing it. And yesterday, the federal government actually launched new guidelines recommending that all provinces actually move towards this model. And I'm hoping that that's just the start of it. The other part is just making sure that we try and not only think about our long-term care homes as part of the healthcare system, but an equal part of the healthcare system. Because we've seen that when our emphasis during this pandemic has been really about hospitals and ventilators, it's almost that the idea that these homes were the most vulnerable and the greatest people at risk, it seemingly got a bit neglected at the beginning, and it's only that we're playing a game of catch-up only after it really became so deadly and apparent about how necessary our attention needs to be in these environments as well.
Doctor, we just have a few seconds left, but I did want to ask you one final question. We have been told that if you have a relative in an elder care facility, to not visit them, to protect them because they are at this risk group. In light of all this, what would your advice be to family members?
Right now, the federal government has published new guidelines, guidelines that I helped to influence, basically saying there are key things that every home in Canada should be doing. I would contact your home and ask them, are you following those guidelines? And there are families out there who are saying right now, my home is an outbreak, they're understaffed, or I'm not sure that my home is following these guidelines and protecting the staff. And so for those families, Ontario and Nova Scotia have actually passed new regulations to support families who may be in a position to take their loved ones home, to enable that. But really, what we need to be focusing on first is making sure these homes can provide safe and effective care, because if we do, then families don't even have to worry about that option, like the lady we just heard from.
Dr. Sinha, I want to thank you for your time. Really appreciate it.
Thank you, John.
Dr. Samir Sinha is the Director of Geriatrics at Mount Sinai and the University Health Network Hospitals in Toronto.